Ooh. So,
This is Dr. Johnson, how are you?
good. How you doing? What you got going
Good.
on here over there? You got the little bow.
Yeah, I'm missing a braid, so that's how you had them. One slipped out. You gotta get creative. I gotta tell y'all my little secrets. Not that you would care, but
You gotta do what you gotta do.
man, I've been wearing it like down on that side to cover it up, but today I had to host a lot of meetings, so I was like, let me do something a little bit better.
I'm still in this damn office.
You still at work?
Yeah, I am. Can you hear me?
Delivering babies?
No, you
You
said what?
want to call delivering babies too, or just at work?
Oh, I don't touch any prenatal baby. I don't do none of that.
Oh, okay.
Over with.
Oh, okay.
Just in this office was doing stuff, and I forgot. I was like, damn, it's about to be 6:30. I'm tripping.
I got off work like less than an hour ago, and I was like, my manager kept texting me stuff. I'm like, I gotta go do a live, and I ain't got my YouTube makeup on. I'm like, I barely had the bow covering the missing braid.
Oh, damn.
All right, so I see the numbers climbing.
Into it.
Welcome, everybody. Welcome, welcome. So I am Cola Red, and we have Dr. Johnson, better known as Doc P, with us tonight. Thank you, sweetheart. And we are doing our monthly or every 6-weeker or whatever you want to call it live, the coordinated live. So you can ask your own questions. If you don't know who I am one of many of Doc P's patients that underwent minimally invasive surgery to treat fibroids. And after sharing my journey, we had a lot of interest in my journey, questions about people's own journey. So we decided to make it a regular thing where we go on and we allow people to ask their own questions. So if you're joining tonight, you have opportunity to ask your question yourself. Please use the question bubble with a question mark in it, because as the screen scrolls, we can't see them. To put your questions, you can request Dr. Johnson to join the live. And also, I do have some submitted questions, of course, as well. So let's get to it.
Let's go. No time like the present.
All right. Pregnancy. First question, pregnancy after fibroid removal. How successful are multiple pregnancies after a myomectomy?
So this is a good question. This is actually, I swear, it's like it always happens to where I actually deal with the question the exact same day. I had this exact same question, and I end up saying, figuring out a good way to explain it. It's very difficult to answer this question because when you look at the entire spectrum of women that have had fibroids, or fibroid surgery, realize that I have women everywhere from 31 or 30 years old all the way to 50 that are trying to get fibroid surgery, right? So they said your screen blurry.
Yeah, I saw my daughter say that. I don't know what to do. It's just on regular Wi-Fi.
Oh, God. So from that are getting fibroid surgery, and so when it comes to fibroid surgery, I am not God, right? The only thing that I can promise you is that I can restore your house being your uterus, so that you have the ability to carry your own pregnancy. That's all that I can assure you of, is that when you have surgery with me, I'm going to remove all the fibroids and give you the house. That does not, there's so much more that is involved with pregnancy other than an intact uterus, it's semen. You have to have a man first, and you have to have the semen, right? You have to have, and his semen has to be viable. You have to have, uh, fallopian tubes that will allow for the passageway of that semen to the eggs. You have to have quality eggs that are now being released so that they can release the semen. Then you also have to have a house and endometrium. You have to have the ovaries that are producing the hormones to not only establish a pregnancy, but to maintain a viable pregnancy. So all of those things come into to play. So realize that, when I have a woman or women that are in their mid 40s and they don't have eggs frozen, and they, maybe not have the money for in vitro fertilization, but are doing this because they want to take their chances to preserve fertility. It's difficult to put and assess them with my 30. I just performed a myomectomy on a 33-year-old healthy woman, um, in a that has a husband, that otherwise has everything perfectly laid out other than fibroids, and they're going to get pregnant. I mean, they're both are going to attempt pregnancy. So looking at those ratios and looking at the success rate is very unfair to really put a number on that, because everybody does not have the same ability. And when you look at um, even women, like, you could give me a woman that's 40 years old that has horrible fibroid disease that undergoes a myomectomy, and you can have a 40-year-old woman that is perfectly healthy, no fibroids, and still has issues getting pregnant, right? So it just goes to show you that fibroids are not the only reason that women are not getting pregnant. So that's a very unfair question. But I can assure everyone that I have patients that have had surgery that get pregnant. Right now, I have a 38. Well, I have a patient that I performed surgery in 2022. You guys can look her up. She didn't even tell me, but she's on Facebook, showing her pregnancy or whatever. I'm so proud of her and happy for her. But she's 38 weeks now, and had very, very extensive fibroid surgery. But, she came in with her husband. She's young, she's healthy. It was a very difficult surgery, and it was almost to the point where it was like, I don't know if I can even save her uterus. I did. I did everything possible for her, saved her uterus, and she ended up pregnant. So I have many stories like that, but it's just very difficult to say what's the percentage rate or what's the likelihood or what have you, because there's so many other factors that go into pregnancy other than just removing fibroids. Hope that helps. I know that's kind of long-winded, but I gotta say all that.
No, it's very thorough because trust me, sound bites will get you. All right.
And so somebody asked, like, what's the hardest part of the OBGYN residency, and would you recommend med students to go into the specialty given what is happening with abortion? Yeah, uh,
We did not hear the question that way, reading it like that.
I'm sorry. So Jackie Anderson had asked, all right, this is the last one I'm answering it like this. Y'all put it in the unanswered bubble because it's hard to answer these like this. But she asks, what's the hardest part of an OBGYN residency, and would I recommend med students to go into the specialty given what is happening with abortion now? I would say there's a lot of different. Residency is difficult all across the board. I don't care what specialty you go into. It'd be emergency medicine, surgery, or whatever. It's long hours. It's having to, uh, you know, just get on the job, training and skills, and really just establish a very, very difficult skill set over a short period of time. 4 years is not that long, so that's a challenge, and that goes for every residency. But abs- I, abs- I encourage med students or anybody to go into the specialties or go into whatever you want to do. If you're passionate about something, regardless of what's happening in our world and our environment, don't run from something that you're passionate about. If you don't like what's happening, you have to be the change that you want to see. So I would never tell you to not go into OBGYN specialty. Like, for instance, for me now, like, I don't do obstetrics. I'm like 100% GYN unless one of my patients come in from surgery and want me to deliver the baby, but that's rare. But right now, all my patient population is 100% GYN. So though I'm concerned about what's happening with abortions and the laws or what have you, it just doesn't impact my daily practice. I speak out against it. I advocate, for women to have choices, and I understand that everything that's going on right now is just totally wrong. But at the same token, it just doesn't impact my practice per se. So, don't not go into an OBGYN residency because of what's happening with abortion right now. Like, don't run from that. All right, I'm not answering no more questions there. It's all
As
you.
long as you read them, I don't mind. But you be oh yeah, let me
I
answer. Nobody
read
knows what you
because
said.
everybody can see it, so I was like, I'm trying to just kind of zoom through it, but my bad.
So I'm like, wait, what are we answering?
My
Okay. Why would some doctors advise to perform a midline cut instead of a C-section cut to remove fibroids from a uterus that's stretched above the belly button?
Excellent question. So with everything, there are skill levels and comfort levels, right? With every single thing you do. For instance, like with mechanics, you have mechanics that can fix whatever it is. You give them any type of car, they can fix it, and they can do it quickly. Lawyers, like I actually use the same analogy with a lawyer that I had a consultation with a few days ago, and she asked me the exact same question, and I flipped it on her. She's a criminal defense attorney, and I said, "Hey, right now, have you seen people that are in jail that?" My bad.
That's okay.
So, have you seen people that are in jail that, if they were in your hands, would have gotten off, right? That things were missed, that things, the argument wasn't correct, or what have you? And her answer was yes. It's the same way with medicine. It's the same way with surgery, specifically fibroid surgery, right? Vertical incisions always make it easier to remove big masses. It's easier for a surgeon. It's going to be less time, less struggle, less issues from a surgeon, less possible complications because you can see everything you're doing, right? So it's easier to make a big midline incision to remove something. It's harder to remove that through this type of incision. It's more difficult. It's a lot more risk associated with it because you can't see. A lot of times I'm operating and I really can't see. I'm doing it by feel. But I do that because my thought process is always worried about a patient's healing, a patient's future, how she's going to have to talk to her partner, to people about that scar when she's wearing a bikini, when she's wearing her panties. Like, does she have to explain that to somebody when she looks in the mirror, how her mentality is? Like, that is the rest of her life having to deal with that particular incision, with the pain, the possibility of infection, or what have you. So with that, I have chosen to inconvenience myself, because don't get it twisted. It's an inconvenience for me to do surgery the way I do it, but it's a huge convenience to my patient. So I make that sacrifice because of the benefit that it offers the patient. In addition to that, I have acquired a skill set to be able to do that. I've acquired a skill set to be able to remove a 20-pound fibroid through an incision that looks like that. Like, a lot of that was like Stevie Wonder. Like, I'm literally cutting stuff in there, but I'm feeling. I know I'm comfortable because I've done it so many times, and I know what I'm feeling, and I know how to safely do things. Doing surgery without being able to see makes people extremely uncomfortable, as it should. But again, it's comfort level, it's skill level. All of those things factor into uh, the the approach to surgery. So, if someone is not comfortable or skilled, they're going to do what makes them comfortable and what makes them skilled. And unfortunately, for women, vertical incisions are not good for you, but it allows the doctor to be able to perform your surgery in 2 hours, go home to their kids, do all of their stuff, whatever. Damn, what you got to worry about in the future, because they're going to get paid the same exact amount. But the thought is, hey, you had a successful surgery, we did what you want. They're not worried. Cosmetics is not a part of it. The possibility of you having an infection that's above the umbilicus, there is a skill level that you have to be able to get it through this type of incision. It's just straight up and down. You have to have the skill level to do it, and if you don't, you're just going to be comfortable and do whatever it is you want to do.
Right.
Hope-
I don't think that definitely answered it. What's the downtime from the surgery? And I think they mean myomectomy.
That's a difficult question as well, because myomectomy, like, is levels to it, right? It really kind of depends on how difficult the surgery is, how involved the uterus is with fibroids, meaning like how extensively damaged the uterus is from fibroids. Like, it really matters, like, just how bad the situation is and how bad surgery is gone. Like, I've been in surgery for 6-7 hours pulling out fibroids. That woman is going to go through a longer recovery than somebody that took me an hour and a half, 2 hours, and it really wasn't that bad. So it's very hard to say, give a direct answer. Typically, patients are in the hospital for 24 hours. Excuse me, 48 hours, 2 days. Typically are there for 48 hours, and usually are able to do most things, meaning able to get back to work, do a lot of the things that they normally do within about 2 weeks. Sometimes it takes a little bit longer than that, but usually after about 2 weeks, they're able to. You can't lift heavy. You cannot. One of the things you cannot do is lift very heavy. You can't get pregnant for 6 months. So it's things that you have restrictions on, but typically you're usually able to get back within about 2 weeks or so, minus, very manual labor type stuff.
All right. I see the numbers changing, so just so FYI, if you're just joining, feel free, if you have a question tonight, to put it in the box with the question mark circled, so that way we can not disappear on the screen. If you want to send Dr. Johnson a request to join the live, you are more than welcome, and we will let you have pretty much free consultation on the spot. One of the questions in the chat is, can we talk about other gynecological issues other than because there are so many OBGYN issues that impact women? Yes, you are welcome to ask any question that you want. We talk about health, sexual health, non-gynecology issues, patient experience issues. And I haven't had everything, but we do talk about the stuff that I've dealt with.
Yeah,
And
no point, just your experience, like patient experience stuff. So
yeah,
that's who.
so the floor is open. Anything you ever wanted to ask the doctor and didn't think you were in a safe space, you have that tonight with us. All right, I'm gonna go to a submitted question so I could go back and forth. Sorry, I thought I had it pulled up, but as soon as my daughter was interrupting with the blurry screen, it's gone.
Yeah, you in the game now. Look at that.
I was too afraid to turn off the Wi-Fi because I thought I'd break something. I was like, whatever I look like, I would just have to look like, because these questions for y'all anyway.
Exactly. Like church.
All right. Okay, next question is actually another, it's not about fibroids, but it is there a cure for adenomyosis? And
You won't answer it. So the definitive cure for it is hysterectomy. So there are treatments. There are things that can help with the symptoms of it, but there's no true cure for it other than removing the uterus, which is what's impacted. It's a very difficult thing to hear, but are women with adenomyosis, do they have the ability to have children? Yes, they do. Do they have the ability to keep their uterus? Yes, they do. But just realize, as long as you have a uterus, you have a potential for problems. And if you have adenomyosis, that those problems can be significant. You choose to keep your uterus because you are strongly desiring to have a child, none more, none less. If you don't have that desire, then you are suffering with adenomyosis and trying to fix the symptoms, but the definitive treatment for it is hysterectomy.
All right. Next submitted question. What question should we ask a provider to make sure they will remove all the fibroids with a myomectomy?
Love it. Love that question. Beautiful. Um, number one, ask them, what is your philosophy on removing fibroids? Like, do you leave fibroids? Like, if they are in different places or what have you, what is your approach to fibroid removal? That's a very fair question. What is your approach to repair of the uterus? And if there is cavity involvement, that is a fair question. How many myomectomies or surgeries have you performed where you went in to preserve the uterus and end up having to perform a hysterectomy? That is a fair question. What is your skill level? Not excuse me. What is your experience with myomectomies? Roughly how many have you performed? How many have you performed in the past year? That is a fair question. What is your experience with dealing with women with advanced fibroid disease, with large fibroids past their belly button or past their umbilicus? That is a fair question. These questions that I'm telling you are very, very specific. And if your surgeon gets uncomfortable, they're not the one. They should be able to answer those questions very directly without getting upset, and to your satisfaction. And they give you a very clear indication and understanding if that surgeon makes sense. If that surgeon makes sense for you, if that surgeon is going to do the things that you want to be done. That's those are fair questions. It's somebody that's wanting to get in on a live shot. Let him in, or you got another question?
No, I actually was gonna ask if it's somebody wants to join before I go back to the chat bubble.
Okay. See if Instagram let us be great. There she goes.
Hello. I didn't know the video would be on, but the back
Yeah,
is
you
so
gotta
I'm looking
come.
rough. What?
You got questions? You gotta come on.
Oh,
We gotta make sure you're not a bot. Come on. We here.
okay. I'm not
It's
a
a
bot.
safe space. It's a safe space.
All right. So my question is just as far as, I mean, I've seen your work. I've been following, and I have a very close friend who had a procedure done by you, and I've heard a lot of great things. And my question is, have you had experience with, removing the large fibroids through the small incision, and especially if those fibroids are heavily vascularized?
So you can go back a month ago and see a 20. I guarantee you don't have bigger than 20 pounds.
Okay.
So that is the most vascularized fibroid in of existence. That fibroid was easily greater than, I don't know, 90 meters.
Wow. Okay.
So it had a blood supply from the inferior vena cava. It had a blood supply from peritoneum. It had a blood supply from all bowel. It had a blood supply from the uterus. It had blood supply from commandeered blood supplies from all of these sources to be able to feed itself to that point. And it was really legit one large dominant fibroid that I was able to remove through, and it's all on there through an incision this big. So if you scroll back, it's on TikTok. Like her belly had like 4 million views, just me touching her belly. So yeah, that, and then you can see the after, what her incision looked like, and what the actual specimens look like.
Okay, and then
here I saw her on. She'll probably pop up in here. Her name is Danielle, but she'll probably come um second. Not enough shout her out. But wait, I'm sorry.
Got it. And then I know
She said
um,
that's her right
She
there.
said, I'm here. She here.
also just with pedunculated fibroids, I know there's some limitations, you can't go past 38 weeks is that with everybody, or, if
What do you
the
mean? What do you mean?
if you have pedunculated fibroids, does that also mean that they're removed and it's not affecting the cavity? Um, do you still
No,
have to follow that rule and go 38 weeks, or is it a case by case thing?
so believe the answer to that is no. And actually, Danielle is a prime example. Actually, she is maybe one of the only examples. So as bad as her fibroid was, it was all productive. So it didn't even really change. It was literally like, I have video where it showed like the fibroid and her uterus that was actually just there, like uninvolved with this fibroid. So as I removed it, she when she gets pregnant, she has every ability to be able to deliver vaginally, uh,
Awesome.
which women that have fibroids like a tenth of her size that I wouldn't let deliver vaginally or go past 37 weeks,
Mm-hmm.
just because of the damage of the uterus. So it's really tough to tell that, before surgery and before you can actually see it. But that's rare though. She's
Got
she's rare. She's rare in a multitude of different ways, but uh, it's for the most part. Once you do have extensive fibroid disease, there is going to be there's going to be myometrial involvement, and to that point, I don't recommend, even if it doesn't touch the cavity,
it.
that still undergo a vaginal delivery. The risks are just too high, and usually 99 times out of 100, she might being the one out of 100. 99 times out of 100, it's going to have significant at least myometrial involvement to where you have to repair the uterus, even if it doesn't go down to the cavity. Myself personally, I was within the past year and a half, 2 years. What I've started to do is even breach the cavity, even if it's not, because it's so many patients that I get all of the fibroids, and I'm thinking I'm getting them all, but they actually have fibroids in the cavity, even though
Mm-hmm.
there was involvement, and leaving those, she's still going to have problems. So I still go in, make a small incision in the cavity, stick my pinky in there, and feel around the cavity to make sure there's no fibroids there, make sure she has a clear cavity, then close it, and then repair after that, even if there's no cavity involvement. And I think everyone really wants that to happen, because the worst thing in the world you can do is this extensive fibroid surgery,
Mm-hmm.
and then you got a pea size or a marble size fibroid that's in the cavity that you leave because you never really searched it out.
Right. Got it. Well, thank you so much.
You're
You
very
answered all
welcome.
my
Very,
questions.
very welcome. Thank you for logging on and not being a bot and let us see
Hey,
your face.
it was
It's
important.
all,
Very important.
Yes. Thank you so much.
all right.
All right. Next question in the chat. Can we talk about Bartholin Bartholin cyst? Oh,
Arthrolysis.
okay.
Sure. What did they ask about?
They just said, can we talk about it? So they didn't really.
All right. So the Bartholin gland is a gland that's literally. Oh, where's my damn? I was looking to see if I had my. All right. This is gonna be horrible, but all right. So look at this as like the vagina, right? That being the cervix up here, but this is the vagina, opening of the vagina, right? So Bartholin cysts are literally like where my watch and my Whoop band are at. Like that's where they sit at, outside on the bottom, like in between, like the bottom of your, like not in between, but it's like at the base of your vulva like really down low on the outside of your external labia, your labia majora, right? So there are glands that are there that normally you wouldn't feel or see, right? But just like any gland, it can get clogged, it can get blocked, and infection can form, and it can form cyst. And so with that, when that happens, if it happens very early on, like in your 20s, 30s, or whatever, you can just drain it, instead, and just basically lance it and drain it out. But a lot of times, what can happen is that when you do that, it can close off and it can reaccumulate. You can have a reformation of a cyst. And so for that, if it's repetitive, the option is to possibly either remove it or do something called a marsupialization, where you basically shell it inside out and just let it heal from that perspective. Um, the older you get, like 40 and over, if you get persistent Bartholin cyst, then you want to definitely remove it, uh, remove the Bartholin gland, because there's a higher incidence of cancer to it. But they're just regular glands that can form into cysts or even be infected, and at that point you have to, um, treat it with one.
All right. Next question. What is the highest risk of a vacuum delivery?
um, the highest risk, or the most significant risk of a vacuum assisted vaginal delivery, is something called a subgaleal hematoma, meaning that there are different layers of the head. Like, you have the scalp, or the head, and then underneath that there is a layer of protected tissue, the dura, that covers the brain, and then you have the not covers the covers the brain, excuse me, covers the skull, which you can have a bleed in between, like the scalp and the skull, which is called a subdural hematoma. Those are not bad. So those are the most common. Those can happen. Those are walled off, and they're just like big knots, big hickeys, or whatever, and they don't have room to expand. But then you have the skull, and then the skull is the actual, dura mater. So dura, or the covering of the brain, right? And so for that part, if you get a bleed underneath there, that can be life threatening for the baby. That can kill the baby, and that's a rare occurrence that can actually happen, that I've seen happen. Um, and it's just one of those things that is extremely rare. I've only seen it one time. It is a very sad situation when that happens, but that's one of the most significant risk factors to the baby. For the mom, you have increased risk of, tearing. So third degree lacerations that go basically uh, in the perineum, which is from the vagina to the anus, all the way close to the anus, and even fourth degree lacerations that actually go through the anus. So the risk of that happening with operative vaginal deliveries, meaning any time you have to put a tool on the baby to help extract. So you use a vacuum, you can use forceps, so all of those can increase the risk of vaginal trauma from delivery. So those are the most common things. You can go down the list and the gamut of things that can actually happen: hemorrhage, infection, all types of things that can happen. But those are the most common risk of having a vacuum assisted vaginal deliveries. But on the flip side of that, it's risk versus benefit too, right? So if you have an arrest of labor, meaning that you're pushing and you cannot, and the baby's not coming out, and the heart rates are decelerating, right, and the baby is in distress, you put the risk of some of those things possibly happening with the operative vaginal delivery now, versus a kid that may not make it, that may have get hypoxic or oxygen cut off to the brain and end up with different conditions from that, developmental delays and those types of things, just because they weren't delivered in a timely manner. So, everything is risk versus benefit. There are risks to vacuum deliveries, but there are also risks to a baby that's not doing well, that's having struggles getting out of the vaginal vault too. So it's just really all about risk versus benefit. Every situation is different. So, it has to be assessed on a case by case basis on, is operative vaginal delivery appropriate or not. If somebody wanted to hop on here, you want me to let them on?
Yeah, I'm gonna ask you this question while you bringing them in. Do you need pelvic floor therapy if you never had children but are considering a laparoscopic hysterectomy and will also remove the cervix?
No, no. So the myth is that the cervix, removing the cervix increases the risk of vaginal prolapse or pelvic floor compromise, which is not true. Um, so you don't, if you perform a hysterectomy, you know I don't recommend keeping the cervix unless there's a particular reason, like if there's already vaginal prolapse and you're doing a suspension surgery. The only time I keep the cervix, one or two reasons. A patient which I just had recently had extensive endometriosis, to where everything was just plastered together down there, and it wasn't even safe to take out her cervix. Uh, like, I had to leave it, and she wanted it left anyway. Um, but there's also a procedure that I perform called a sacrocolpopexy, which is a procedure that is suspending the vagina after prolapse. Like, I basically put mesh on the cervix, use the cervix to pull the vagina up because it's sunken or falling in, and basically tack it up to a ligament on the bones of the spine. So you don't have to. If you do not, I do not recommend just keeping your cervix. Right? If you keep your cervix, you definitely are going to have follow the Pap smear guidelines, and you also are going to be at risk, for cervical cancer, just like anybody else in population. Not to say that it's a very high risk, but it happens. We already just saw, a woman, a young, beautiful woman that just passed from cervical cancer that was misdiagnosed. Uh, but cervical cancer is a very real thing. And keeping your cervix, if you have a hysterectomy, you still have the risk of possible cancers in the future. So, but it does not increase the risk of pelvic organ prolapse or vaginal prolapse. Let's see what this is.
Okay.
Hi,
Hello.
Dr. P. I've been
How?
following you for a long time now. I don't really know what my question is, I guess, exactly. I've had fibroids and cysts for a long time, and I was in the hospital about a year and a half ago for about 5 months due to like a complications that I had with the cyst that had um, E. coli in it, and it like caused me to go septic.
Hmm.
So they ended up having to remove an ovary. When they did that, they found out that I had endometriosis, and it spread after the surgery. And so basically, I've been seeing fertility doctors and other doctors just trying to understand what my best course of action is, because I do desire to still have
Sure.
children. And recently, I was told that the surgery probably isn't a good idea because they removed the ovary, and my AMH, I think I'm saying that correctly,
Yeah.
numbers are so low.
What what
Um,
is what is that number by chance? Do you know?
I don't have it on me. I'm actually coming to Chicago in July. I spoke to your doctor's office today, actually, so I'm like, wow, you guys are online live right now, so I jumped on. But they want me to send over like all my information and my CDs from UCLA, and get you guys my information. But I don't know off the top of my head. It was like or 0.04, something around that.
Point.
So I just kind of want a second opinion. I don't know.
And how? And if you don't mind me asking, how old are you?
I'm 32.
You're
Mm-hmm.
32, and it's 0.4.
Yeah, something like that, or 0.6, something like that.
That is perplexing. Um,
Yee, people I know are starting to get on.
so
Sorry.
so the first and foremost thing that I would tell you to do is uh, seek seek other opinions from fertility specialists, right? Because well, if that is the case, let's say face value that is your number. Uh, the first and foremost thing that I would say do is to retrieve eggs. Like you need an insurance policy, right? While we figure out all of the endometriosis and everything else that's going on in your body, you need to bank some quality eggs so that we have an insurance policy for the future. Uh, if and when you need them, because as we go down this journey of dealing with endometriosis, dealing with everything else, the time is just passing, right?
Yeah.
And typically at 32, you have a lot of time, but given that number, your body is responding differently for whatever reason. And that may be, I would say, definitely get that lab repeated, because that's odd to be for it to be that low with given your age. But if it is that, the first and foremost thing I would say is definitely attempt to try to get some eggs frozen. And then
But
with that being said, there are multitudes of different things to um, get things optimized for you in order to try to move on to the next step of having a child. But we definitely would have to get the endometriosis under control first, because that's a hindrance. Even if your AMH was 10, if you have stage 4 endometriosis, you're going to have a difficulty getting pregnant. So having to get that under control, and then start talking about the next steps of having a baby and getting pregnant.
thank you.
I'm sorry. I didn't mean to upset you, sweetie. I'm so sorry. But we could talk more. So reach out to me. So we'll talk more outside of this. Okay. All right.
A lot of people was showing her love in the comments too, so I think that she got emotional.
I want to help her. That's a lot. That's a lot to go through. But I definitely will do. So if you guys, whoever's watching this, just reach out to her. Just tell her to reach out to me personally, because that's a lot to kind of tell people in this forum. So I totally understand that. But I will do every thing in my power to be able to help her get through that journey, because I'm sure they've told her a bunch of garbage. So I will look at everything that she's going through and to help her for sure.
All right. If you just joining and you want to join tonight, you can send a request to Dr. Johnson and he will have you join in the live. If you have questions and you haven't submitted it to me already, please use the question mark with a circle around it to drop your questions in there. They want to talk about your favorite topic, UFE. I've seen that come up a few
Oh,
times
oh,
tonight.
y'all,
Y'all know he passionate. He finna
y'all know
start
y'all know
cussing.
me my
He,
soapbox.
he finna start cussing.
Uh, uh.
When you
So
passionate about something, you gonna cuss. So
virtual appointments are here. Let me do this right now. Let me pin that. So that's how to schedule virtual appointments. If you are, and I have patients all the time. I had over the past 2 weeks, I've had somebody drive in from Florida, drive in from Memphis, drive in from somewhere on the East Coast, like every driving in from everywhere, or flying in from either flying or driving, coming in for whatever. See me. If you want to do that, absolutely. I don't have a problem. You do not have to schedule a virtual appointment. If you come in to see me, you know, reach out to me and say, hey, you know, what's the information so I can come in to see you. That's perfectly fine. Yes, Winnie Nicole flew in. Yes, she did. I was a living witness. So if you want to fly in to come see me, you don't want to do virtual, it is perfectly fine. You can use your insurance. I have absolutely no problem with that. Virtual appointments are not covered by insurance. Virtual appointments are out of pocket because the virtual appointments typically happen at times like this, or times like when I'm on my off time and I'm talking to you for an hour, hour and a half about everything, answering every single question, everything. I talked to somebody an hour and 40 minutes yesterday. I don't keep time on people because I just don't do that. Like I want to make sure that every single person will never say I microwave them. Nobody will ever say like, oh, he didn't answer my questions. He tried to rush me. I just am not built that way. I can't do it. Even though sometimes I be wanting to do it, I can't do it. So with that being said, if I'm going to talk to you for an hour, 40 minutes, you're going to have to pay for it. I'm sorry. It just is what it is. I'm not playing with insurances. None of y'all out here like Cola right now. If y'all went to go get y'all hair done by Cola and y'all told her that you was going to pay her $50 for a $500 hairstyle that she didn't set up there all day, she would look at you like you have like you crazy and lost your brain. That is what insurances are. There's no other form of anything that works like medicine. When you go to your mechanic, you pay your mechanic their price and what they say. If you go to your lawyer, they charge you about 15-minute increments and you pay them exactly what they say. If you go to your hairstylist, your lash technician, your waxer, whoever you want to put out there, whatever you say, whatever they say, you pay the price.
Price
That is
is the price.
when it comes to medicine, it doesn't go that way. Whatever we bill you, even through surgery, through clinics, whatever it is, when it comes to medicine, unless it's plastic surgery or it's something that is straight out of pocket, if you go through your insurance is going to pay 10 to 20%
Negotiated prices.
that cost is. And the reason they're able to do that is because they say, look, we have thousands of people that you see. We're responsible for your livelihood, your revenue, or what have you. If you don't do this, then we're going to now put you on the list where we don't recognize you as a provider that our vast number of people can go through. So if you're charging $400 for this virtual visit, then we're going to pay you $65 because we can. And you will shut up and you will take it. I'm not doing that. I already have to do it like for surgery because it doesn't matter if you got 20 fibroids or if you got 200 fibroids. Anybody that knows me, I'm going to be sitting there for 4, 5, 6 hours pulling out every single fibroids. I don't get paid for that. I don't. I do that because I have a passion for what I do and I help people out. And I will continue to do that for as long as God says, oh, give me the strength, because it's starting to hurt my neck. I'm telling y'all, my back and my neck are hurting really bad because y'all killing me. But it doesn't work that way. Oh, my neck and my back. You know, I'll be coming home with this little massage, but like, oh my God, I'm about to die. But to my point, like if I'm in there, literally 2 weeks ago, I was in there for almost 7 hours with this woman with a completely destroyed uterus, with multitudes of fibroids that I really honestly believe in my heart of hearts, like she's not going to be able to get pregnant. But I promised her that I would do something. And I was raised to always do what you promise you're going to do. So no matter what I feel on the inside, I'm going to do that. So it doesn't matter. The same surgery that takes me an hour and a half, 2 hours, I'm gonna get paid. The hospital's gonna get paid the exact same if I take 6, 7 hours. There is no like overtime, whatever. Medicine doesn't work that way. So I say all that to say, you find me on social media and you want me to sit an hour and a half, 2 hours, whatever, talking to you about whatever, there is a cost for that. And I'm not apologetic. I'm just saying that this is the way it is and this is why it is what it is. So hopefully that gives you all a better understanding of why it's that way. That's that. All right. Now I'm done with that.
Okay.
All right. I gotta be saying this shit because sometimes people like, oh, he's just, oh my God, he's charging all of this shit. He's just
Tell them yesterday's price is not today. Man.
told you that viral shit when they tried to assassinate my character made me go viral. They made it bad for everybody else. I'm still gonna help people, but now I'm like, all right, now all of this sacrifices and stuff, like now I'm gonna start looking out for myself, because at the end of the day, nobody gives a shit about me, really. Well, I'm not saying nobody, because people do love me and people do care about me, but when it comes to the world, people just, they'll try to discard me. Like they really try to like assassinate my entire character and make it so that I lose my license and fuck my kids and all that stuff, like for nothing, just because I said, people should choose or look for the doctor that's going to take care of them. For that, I had to go through hell and back, but I didn't care, honestly. But with that being said, I start to think about myself and not be as selfless, even though I'm continuing to be selfless. I'm just like, people don't, it's not enough people out here that really actually care. There are some, but people don't really care at the end of the day. So I have to care about me. And so let me shut my mouth. There's somebody else that want to get on here.
You can't work yourself to the point of where you don't even have
Oh yeah,
peace.
whoa, love you too, Q. That's my, so she comes in number 2. She had like she put your little fibroid to shame, Cola.
Oh, you finally called it little, not the laptop. Thank
Look,
you.
at that point, I was like, damn, Cola, you got a big ass fibroid. Q's fibroid was like get out the way, Lord.
Right. Well, and what did I tell you though? When you was talking big stuff about me, I said, P, it is way more people that you don't even know. And when you were saying like, well, we just gonna talk a little bit, and I was going, okay.
And look, Q, she came up here and was like, yo, please fix this shit. And I was like, damn, mama, okay. We did it though. We got through it. Like 17 and a half pounds.
I am so happy to hear that. I'm so happy to hear that, because it's a lot.
Let me see what's
okay. Well, the question was still about, they want to talk about your favorite procedure.
Okay. What's the specific question about
UFE versus myomectomy. UFE, just talk about it. I done seen it a couple of times tonight, and it's been submitted a couple of times this week. I know you have a video about it, but people like to hear you cuss.
And I've argued with like radiologists and stuff about it. It was a radiologist. I had to go at him because he tried to use like my fibroid slayer. I'm like, no, it's trademark. You need to stop that, please. Don't do that. Oh well, a patient, nah, my friend, no, I'm me, I'm him. Like, don't do me. But UFE, uterine fibroid embolization, uterine artery embolization, in my opinion, let me start off by saying that this is prefaced with my opinion.
And patients that you see after the fact.
That I actually see, and I'm gonna tell you. So I'll go into why my opinion is the way that it is. But in my opinion, is a trash procedure, and I'll say that very clear. I don't like it overall. Now, there are certain instances in which UFE are indicated, like for people that have multiple comorbidities, meaning they have all type of illnesses and issues and they can't undergo surgery safely or what have you. It is a minimally invasive approach to help temporize things for them. So I won't say it's complete nonsense, but it is for very particular instances and patients. It's a very good thing. But for a global overall, and let me explain what it is. So uterine fibroid embolization, uterine artery embolization, they're synonymous. Those are two things in which a interventional radiologist is going to scan your pelvis, your female parts, look at the blood flow or the blood supply, the arteries that are feeding the fibroid, and they send a sclerosing agent, which basically cuts off the blood flow to those arteries. To those fibroids. They usually go through the groin, through a big blood vessel in your groin, or through your arm. And The reason why I say I don't agree with it per se is because I see nothing but fibroid patients. That is what I do. I talk to women about their fibroids all day, every day. That's what I do. That's my life, at least for now. And if you give me 100 of them, the overwhelming majority of them, and I've seen well over 100 of women that have had it, the overwhelming majority of them do not like it. They're in pain. They're having issues from the UFE. There are some women that have UFEs that do well, but those women are in the minority. And for me, I don't offer things that don't work for the majority. And that's just my personal experience. Other people may have different experiences, but me, as somebody that strictly deals with women with fibroids, this is my personal experience. And I equate it to this. If you ever had a long morning on the toilet, if you ever had a long morning on the toilet, where either A, you just having a bad morning, or B, you are just like stuck in like the social media frenzy, you scrolling, and it's just all type of stuff that you're interested in, and you sitting on that toilet for too long.
And you don't have
If
comfort height.
if you do it for too long, you start to feel a tingling in your feet. And if you stand up, it's like start to hurt. You got to sit down and let the blood flow and the oxygen get back to those tissues. Like everybody has experienced that. That tingling is from something called hypoxia, right? Meaning that lack of oxygen, you cut off the blood flow to your distal extremities or to your legs and your toes, and they tingle because they have a lack of oxygen. That is the equivalent, right? Fibroids are living tissue that rely on blood flow and blood supply. When you cut the blood supply to that tissue, it can cause something called ischemic necrosis, in which you have now dead tissue that doesn't have a blood supply that can be extremely painful. This is much more painful when you have fibroids that are large and that have a large amount of tissue that are getting a large amount of blood flow that are cut off to it. So for me, that's why I don't recommend it. However, I am not a I don't let my bias dictate how I, talk to people. When you come to me, and any patient that's ever seen me, I tell them I have a bias. I have an opinion. However, I will never take the option away from you. I still give it to you as an option because it's not me that should be dictating your option. It's me giving you informed information. Giving you information to allow you to make an informed decision about what makes sense for you. So I always will give it to you as an option, but my personal opinion about it is if you are my sister, my aunt, my mama, or anybody that I love or care about, I would not recommend you do it. And that goes for my patients because I care about all my patients too. So that's that.
All right. How we looking on time? Because it is an hour. The first hour. We at the first hour mark, and you still at work, so you tell me.
I gotta get my ass about it. We'll do about another 15, 20 minutes. That's fine.
Okay. Is there somebody that was requesting to join before I go back to the question box?
Keep calm and pray. She love hopping on here with us. Let me let her in. Hold on. This her joint. She waiting on.
I know, right?
Hello. Hello.
Yeah. Ma'am, what's your name?
Yeah.
Luann, we got this, okay? Okay, let's go together. Ready? Do this. On three.
No worries.
Okay.
Okay.
Back to the question box. We good? Nobody else? Okay. My daughter is only 20 years old and has been diagnosed with fibroids. Her cycles are extremely long and almost unbearable. Her OB has tried a couple of things for relief to no avail. Is there an age that is too young to consider surgery?
Great question. All right, so I have to give a shout out to my colleague, my friend. So somebody asked about can I recommend someone for egg freezing? I absolutely can. There is a doctor who is in Chicago. She's a good friend of mine. She's somebody I trust and talks to people just like I talk to my patients and has a platform similar to mine. Her name is Dr. Erica Loudon. She's with Kind Body Fertility. So if you guys are looking for a Black woman that is going to be very honest and talk to you extensively about your fertility future, she is awesome, and I refer all my patients to her. Again, her name is Dr. Erica Loudon. She's in Chicago at County Body. All right, so that's that. So as far as surgery, to
Too young. Are you too young? What's the age that's considered too young to start considering options?
I would not necessarily say that 20 is too young. I would personally say that I don't think I've operated on someone that's 20 for fibroids. So the reason that I would have reservations about that is that I would have to see way more with her history, because it's unlikely. I would have to actually see it, but it's unlikely that she has fibroids that are significant enough that require operation. Most likely, and two things can be true at the same time. I say this all the time. It's on one hand, a woman can have fibroids, and on the other hand, she can also have abnormal uterine bleeding that are not related. So you can have fibroids, and the fibroids are not the cause of the bleeding. And you have to you have to know what you're talking about and how to deal with those things and how to explain them from a size location standpoint, as if to better understand if the fibroids are actually impacting or causing the bleeding. And I would venture to say that that 20-year-old woman is not having her issues because of those fibroids. But I would have to see more. I can't really speak on it as a first time for everything. But just off of knee jerk and off the first thing that I can think about, I don't believe that she's probably in a position to not in a position, but that surgery is the first and foremost thing for her. But like I said, I would have to see more. It's not to say that she's too young, but she has to. It has to be assessed whether or not fibroids are her true problem, and if surgery is going to help her with her bleeding and issues, because it may be just a medication thing.
All right. Will you
Yes,
ever? I'm
your
sorry.
consultation, I would recommend that. That's just not a good thing. Okay,
You reading again?
I am reading. Let me stop. I'm done.
No, you okay? Um, Sorry. Let me go back. Okay. Once the fibroids are removed, what is the chances of it growing back?
Great question. So I say this all the time. So um, this is my new analogy. I like this analogy. So fibroid surgery, the success of fibroid surgery and the likelihood of fibroids returning depends on if all of the fibroids are removed, right? And it took me a long time to really come to that conclusion. It just from a common sense perspective, and I say it like this: out of I've over the past 2 years, I have done at least I would say maybe 150 to 200 myomectomies, and in that span of time, I can't recall. I cannot recall a patient that has had less than 10 fibroids. There's always double digit fibroids. Anytime I go do a myomectomy, it's always double digit fibroids. It's rare in which I have single digit fibroids. If you do an MRI ultrasound, you'll never see an MRI. Very rarely will you see an MRI. I never say never, but you'll very rarely see an MRI or ultrasound that is going to even list 10 fibroids ever, right? So that tells you something. That means that they're not going to mention it on ultrasound, and they're not going to mention it on MRI. So this is the equivalent. This is my analogy. Tomahawk steaks. If you don't eat steaks, forget it. But you know what a tomahawk steak is. Big just piece of just steak and meat. Imagine in that big piece of meat you just hide marbles and grains of sand and little peas, and you just put them. You put like 30 of them all throughout that tomahawk steak, and then you throw a baseball on top of it. You throw a softball on the side of it, or what have you. Well, if you look, and then you have the only option you have is to take your fork and knife and to pick out all of the things that are put into that tomahawk steak. You'll get the baseball, you'll get the softball, you'll get all of the big things that you see. You will definitely not get all of the peas and the marbles, and you definitely will not get the sand that's in that tomahawk steak if you only are allowed to use that fork and the knife. But if you are able to take your fingers and to run it through that tomahawk and feel where you feel all of the lumps and the bumps that are all through that, you would then able to systematically find all of those marbles and specks of sand and be able to remove them. That is the equivalent of laparoscopic myomectomies versus open myomectomies. And that is why about 5 or 6 years ago, I stopped performing robotic myomectomies because my common sense told me that if I can't see it, I know I'm leaving fibroids. I absolutely know that there are fibroids that are going to be there. So if that's the case, when a patient comes to me after having a laparoscopic surgery, hell, some of y'all even have had open myomectomies, and they say, hey, I have patients that have had myomectomies in 2020, 2021, 2022 that are coming to me for surgery now, not from me, but from other places. And they come to me and say, Dr. P, my fibroids are back. And I tell them they were never removed all the way. So it's not impossible, but it's very unlikely for in 2 years for a fibroid to now regenerate and grow new, to now form new, and then get big enough for there to be a problem. If you leave it, it already has a head start, and it's going to get bigger, or it can get bigger. So for me, laparoscopic surgery for myomectomies doesn't make sense because you leave fibroids behind, and if you leave fibroids behind, that's the catalyst for them coming back in the future. So if you want the opportunity to never have to have fibroid surgery again, you want to remove every single one of them, which is what I do. And that's the transition that I made from not performing robotic surgery. And not to say that I wouldn't, because if you came to me and say, I heard you, Dr. P, I still want to do a robotic surgery. I'm a robotic guru. That's fine. I'll do it. But what you're not going to do is you're not going to get a robotic surgery from me, for a robotic myomectomy from me, and then come back 3 years and say, he really ain't the fibroid slayer. I did a robotic myomectomy from me, and then now I got to come back because I got these fibroids. I will blast you. I will expose you. You will not do that because you did what you wanted to do. You didn't listen to common sense, right? Or you listened to a doctor that said, oh, he doesn't know what he's talking about. When I'm giving you common sense, I can't make any more like clear analogies that make sense for people. You know, you have a decision to make about what you listen to and what you don't listen to. And that's what I'm saying. As a surgeon, I'm telling you that if I perform a robotic or laparoscopic myomectomy on you, the likelihood of leaving fibroids behind is extremely high. In addition to that, once we start to pull fibroids out of your uterus, you are obligated now to have a C-section, as we just discussed. So it doesn't make sense to do a surgery in which I'm going to leave fibroids behind with these little bitty incisions. Yeah, you're going to recover quicker. Yeah, you're going to have, damn, I'm making all type of stuff up. Yeah, you're going to recover
What
quicker.
upgrade is that?
Like, damn, bombs bursting and shit. But like I said, something real profound right there. We really was. So it doesn't make sense to do a surgery that you're going to have a higher likelihood of returning from it, and then have to have a C-section any damn way. Why don't you just make an incision that's small and low, get all of the fibroids out, feel it, get all of the damn fibroids out, and then guess what? Oh shit! Use that same incision for the C-section that you got to have for this baby that you want anyway. It's just common sense. I tell people all the time, I am not the smartest doctor in the world. I am not the smartest person in the world. I will tell you, like, I'm just not. I'm very realistic. However, When it comes to common sense, I am creme de la creme. Like my common sense is next level, and I use my common sense in medicine, right? And people don't talk about common sense. You could be as smart as you want to be, but if you don't have freaking common sense to say, hey, even though I'm doing something that I think is right, let me take a step back. And does it make common sense? Because I didn't learn these things that I'm talking about in medical school and residency. I didn't learn them. Like I was doing robotic myomectomies throughout residency, and I was like, when I came out and doing surgery, I was like, oh shit, I'm a robotic guru. I don't never have to open anybody. You could always do robotic myomectomies, blah blah. I was doing it for years and years and years. And I was like, hold up. Anytime I open somebody to do this shit, it's 30, 40. I pulled out over 300 fibroids out of one human being before. There's absolutely no way that I could sit up there with a fork and a knife or two tools without touching it and to remove 300 some of the fibers. It's impossible. Absolutely no way it's going to happen. So with that being said, why do I take that risk with anyone? Not just the ones, hey, maybe she only have 3 or 4. Why take that risk? Like, you want me to get all of the fibroids. And so that's my aim to do it. So let's both make the sacrifice and just do it. You know, it just makes sense. All right, I'm done. That's a passionate one for me.
Experience is the best teacher sometimes. All right, so we at 7. We at 10 minutes from an hour and a half.
All right. Yeah. All right. We'll do the hour and a half.
Okay. I'm just making sure. Right. Don't be yelling at me later.
We'll do the hour and a half.
All right. What does chromotubation mean?
Chromoperturbation.
Oh, thank you.
Chromo is color. Perturbation is just basically putting that color or that dye through the uterus and seeing if it goes through the tubation, right? So it's a dye test to see if the dye can spill through the tubes and you can see it. And it's just basically a test to test for patency of the fallopian tubes.
How do you remove every fibroid without doing too much damage to the uterus?
Skill level. Said being meticulous, being very meticulous with surgery, knowing when to be extremely careful around certain structures in the uterus. When it's all removed, being very meticulous about the repair of the uterus and repair of the endometrial cavity. Just being very meticulous and having a skill set. It's just skill level and experience. But to that end, I am committed. I can tell you with any patient, I remove them all, or at least what I feel. Is there somebody that's walking around with a pea-sized fibroid that maybe I didn't get or whatever? It's possible, for sure. I'm not perfect, but it's not from the lack of trying. Like I will sit up there, feel for an hour, 2 hours, make sure that I get every single one of them and then close them. So, and that's just my commitment to patients. But I'm very conscious about the anatomy of the uterus and repairing it so that women can have babies in the future.
All right.
That's fake news. Somebody's asking about teas and herbs. It's fake news. So what I'm gonna do? So my next thing I'm gonna do, I'm gonna put my name on something.
Well, you know my idea.
Because like people just want to buy shit.
You know what? You ain't really selling an herb or nothing. Just you know what I said.
everybody got like money burns a hole in everybody's pocket. So everybody likes to just give away money. If it sounds good, you want to give away money. So I'm like, why do I keep trying to be the honest one and just say, fuck it, let me just make money the right way. I'm not kicking teas and shit out of people's hands. Let me put my name on some herbal supplement or tea and just market it and sell it. And I don't have to do this no more. I could just be a multi-millionaire, put my name on some shit and just sell it. Because everybody, you'll go for it. You'll go for it. But to that point, all right, all kidding aside, realize we live in a capitalistic society, right? If there is a need or a fear, we utilize our resources to capitalize on the need or fear. It's what we live in. That's what capitalism is. So if you have a problem as of fibroids, we always are trying to get a cure or solve a issue. And you don't have to have true knowledge. You don't have to have true experience. You just have to sound good and whatever it is you talking about. You could put a whole bunch of grass in a bag and just stir it up, put a little seasoning salt and some whatever the hell you want to, and put a little sugar in it or whatever, and say, hey, fibroid blasting tea. And you, because it says fibroid blasting tea, you're not seeing who made it, how they made it, what's happening, what are the studies around it, what are all. You don't ask any of the shit. You just said fibroid blasting tea. I'm gonna drink it. I'm gonna give them $35.99 every 2 months, and I'm gonna just drink this tea or what have you. But you never ask like, what's the studies or what's their experience behind the makeup of this. You just buy it. So not to say to the person that asked the question that's what you're doing, but I'm just saying just think about capitalism and everything that you buy. You know, I'm from Chicago. Like, this is the hustle capital of the world, right? They will sell you your own socks, your own drawers. You know,
Yes, they will.
like it's people so bold here. They'll steal your own shit. They'll steal your shit and try to sell it back to you.
Back to you.
So
Yes.
on a discount. Like, they'll really hustle you like you really need it and it's yours. You know, so this is where I come from. You know, so I'm skeptical about everything, but it's heightened my level of common sense and awareness to understand like how the world works.
Mm-hmm.
But everybody has to use that same common sense and awareness. Like, everything is not what people say it is. Like, and understand that people want to make money. They don't care about your health. They just want to make money. And if that's the case, like, just kind of use your common sense with them.
All right. I'll take one more and then we'll be. Oh, depending on how long the answer is.
Okay.
All right. Hello, Dr. P. What is your opinion on hysteroscopic procedures? I have fibroids and wait, no, I'm 66. I still have a period. I don't want an IUD at my age, and I need all my fibroids removed.
Ha. That's crazy. Cause I promise you, all these questions is literally stuff that I just did on a Wednesday. I had a 70-year-old woman that had the same problem, but she fibroids weren't her issue. She had an endometrial polyp, and I ended up doing a hysteroscopic polypectomy, or removing the polyp that was in. She has a little small fibroids that were in her cavity too, and did that procedure for her. Absolutely, at that age, you know, if you do have intercavitary fibroids or polyps that are there, a hysteroscopic procedure is absolutely indicated for you. Even possibly an ablation if need be. But first, making sure that it's not a cancer, doing an endometrial biopsy and a DNC to make sure it's not a cancer. I got to stop with my fingers because this shit is annoying me. Making sure that it's not a cancer, but then also, removing that from a hysteroscopic approach, if that's what's pushing in, if that fixes the problem, then absolutely you should do that because you don't want, it's risk versus benefit. Hysterectomy would end it for sure, but that's a risky surgery, especially the older you get, and being under anesthesia for a longer period of time. Not to say it can't happen, but if you could do it from a perspective of, 15, 20 minutes to be out of the hospital the same day, then absolutely do that. That's a very good option if that's what's causing you to have the bleeding or what have you. Very good option to do.
All right. You want me to take anything else or?
Last one.
Right.
Who's this?
Somebody want to join? All right.
Yeah.
That's how we'll end it then.
That's how we ended. Okay.
He will be requesting a You walk away.
Y'all know she.
Oh
Hey,
no, I'm here.
you here? Come on,
And no,
come
I
on.
switched my phone. So I didn't know you were gonna, of course, add me.
Yeah.
So I'm not sure if you can see me. It's loud in here. I'm sorry. So I don't really have a question, but I just wanted to get your advice.
Sure.
So I had a myomectomy when I was 21. I got
Damn,
pregnant. I know I was supposed to wait, but I think it was
you was
a
21.
month
You had
after my
that
myomectomy.
open my. You
I
had an
got,
open mind.
yes.
Okay.
I got pregnant. Daughter now she's 10. A month after the myomectomy, my fibroids came back. My cycles was horrible. I know you don't like the UFE, and
Your
with me
fi-
being young
number,
and not, or you're,
your
I
fibroids
can
come
barely hear
back.
you. I'm sorry.
Y'all said number one, your fibroids didn't come back. They just weren't removed.
And you know what? I'm listening. I've been here the whole live, and I'm listening to everything. That's why I'm like, let me join and ask.
Hmm.
So I'm guessing you know what? They were not removed.
Correct.
Cycles still went back to how they were. With me being young, of course, not knowing much, I
And
did have the UFE.
I would also venture to say that fibroids were not that. And this goes back to that person's question. Fibroids weren't your issue at 21 years old. You had what anovulatory or abnormal uterine bleeding from a physiologic source,
Hmm.
and you had small fibroids. You didn't need surgery. They just needed to address your bleeding um,
Hmm.
without surgery. Nonetheless, you had it, but it didn't just come back in a month. It literally they did surgery on you, and all of them were removed,
And
and that's
see, that's what, and that's where I was going with it. Of course, with listening to everything. So after I did get pregnant. I do believe it was like 2 months after the myomectomy. They, of course, wasn't
2 months.
removed or whatever happened. Yeah, I know that's what I was saying. Like, I'm like, I'm not like,
God bless.
and it's
God bless.
like,
Don't.
and with the doctor that I was seeing recently, he was saying the same. Like, oh, and I had a C-section, of course.
Mm-hmm.
Um, they, I guess, went through the same incision because I don't have any other
Sure.
scars. Um, so after the C-section, it was 39 weeks too. It was
Wow.
39
That,
weeks,
you got a whole bunch of first, and
and
like it's a lot.
that's what he was saying as well, and he was looking shocked. But I did have the UFE after her. I think it was 4 years after her because the bleeding was so bad. Didn't know anything of, have anybody telling me no, don't do it, don't. So fast forward, my daughter will be 11 in August. She's
Mhm.
my only child. I want another child. My fibroids are back. I can feel them, or they haven't been. I don't know if
Have,
they were ever removed
have you
or what happened throughout the process.
have you had an ultrasound, recent ultrasound MRI?
Um, yes, I've had a recent ultrasound. I were told that they were measuring as if I was 5 months pregnant.
How big is the biggest one?
I don't know numbers, but that's all I remember. That this was the beginning of last
Okay.
year. I did have a biopsy as well.
Okay.
Everything came back good.
I mean,
That was last year as well.
it's when you press on your belly, can you feel hard? Does your belly protrude?
Oh, yep, I can feel them, especially when I'm laying on my back. Like I can feel like it's really hard. Uh huh.
Can you see it? Your belly protrude as people be like, hey, you look
Oh
like you're
yeah.
pregnant.
Am I pregnant? Am I? Yes.
Okay.
And look, and I can look at me. Look at me. Look, I don't mind. It's like, oh, can you see? Is my camera? I'm sorry. I don't mind. Like,
Yes, you are. Got it. Okay. Yep.
and but to further my story, like, so the benefits that me and my husband have now, I do want another child. I've been doing research on doctors. I'm in Atlanta.
Hmm.
Haven't chose anyone just yet. Um, I want to do IVF. I was approved for it through our insurance.
Sure.
Um, I have an appointment coming up for a vaginal ultrasound.
Okay.
I just don't know what I don't. I'm pretty sure I'm going to be told, hey, we can't move forward because you do have, um, of course, my fibroids, or I've never seen a fertility doctor before, so I'm just trying to weigh my options.
And
I'm not sure.
How old are you, if you don't mind me asking?
I'm 33.
Okay. And so, and you're looking to get pregnant within the next few years.
Yes.
Um, and so, you're going to the fertility specialist now to see, or you're planning to go.
My first appointment is the 8th.
Got you.
Yep, that'll be my consultation.
So, yeah, I guess my my only other question is that, well, it's not even a question. I already know your primary goal right now is to have a child, another one.
Right.
Got you. And for people to stop asking you when you do.
And that too. That's number one.
Um,
Especially family.
so
Like, oh my
so so with that being said, you are what I consider my definition of advanced fibroid disease. You are the
God.
perfect example of what advanced fibroid disease is. It's enlarged uterus that is greater, that is at least to your belly button or your umbilicus or beyond, and largest dominant fibroid is greater than 10 centimeters, which I'm fairly certain that you probably have one that's just 10 centimeters or above. So yes, you are.
And the first, mhm. So the
And so
myomectomy I
with
had when I was
that being,
21, it was 10 centimeters.
got you.
Hmm.
So yeah, so I will say definitely they did not remove them all. That's number one.
Okay.
Number two, with the UA, so I would not recommend either treating your fibroids, like, so something like Excessa, something like you've already had a UA. Well, you can't even really get Excessa, because that's another thing about Excessa or laparoscopic radio frequency ablation. Once you've had a UAE, that just kind of that knocks you out as a good candidate for
Okay.
Excessa. In addition to that, uh, procedures in which you're treating the fibroids are not going to give you what you want. They'll help some with the symptoms,
Okay.
but as far as your belly protruding and looking like you're pregnant, it's
Mhm.
not going to fix that. So your next step or order of business would be myomectomy.
Okay.
With that with that being said, your I tell patients like this all the time. When you have advanced fibroid disease, you women like yourself are in the minority of women with fibroids. They're you are in a smaller group, but you guys are still abundant. Um, with that being said, for advanced fibroid disease, the comfort level amongst surgeons when
Okay.
you get to your belly button and beyond dwindles. It goes straight down to, it doesn't get there. The comfort level and the experience of dealing with fibroids of that magnitude, especially from a minimally invasive perspective of small incisions like that, it dwindles. Most doctors that you're going to see
Hmm.
are going to say you need either a vertical incision, or most likely will say, hey, not only do you need a vertical incision, you'll probably have to have a hysterectomy.
Oh
So
no.
that is where you're at. Um, I'm not saying that there's nobody that will offer you that, but there are a lot of doctors that are not going to offer you that. I would never tell you that. Like, I deal with your scenario, your case all the time, every
Okay.
single week,
Yeah, I
all the time.
was offered a hysterectomy when I was 21.
I
Yeah.
bet. So have you been on here the whole time? So that uh uh also Q, like the woman that I shouted out before that I was talking to, my patient, she's actually in the Atlanta area.
Oh,
She came from Atlanta up here to have surgery. So she would be actually an awesome resource for you to reach out to, just to see what the experience is like if you wanted to do that.
right. Oh no, look, I've already been look. I've been watching. I've been looking at posts. So I've been look. So
So I
that's been,
I'll
of
never
course,
want
the
to be like,
steps.
hey, come.
Uh
So I'm
huh.
not, not trying to be
That's been
like,
like
come.
the next step. So I've been, of course, look, I've been watching, of course, and doing research, but I've also been watching your posts and, of course, joining the live. So I'm like, this time, let me get on here. Because it's too much to type, of course, with the myomectomy and the UFE, of course, and the C-section. And then now trying to weigh my options, of course, because I do want another child. And I'm not sure what's the next step, especially
That
after the
that
UFE.
would be the next step. It would be to let's set up a virtual consultation
Okay.
so that now that I can look at like your labs and stuff extensively, look at your ultrasound, look at, you know, if you have an MRI, and then talk to you about your medical history, talk to you more extensively about your surgeries,
Okay.
talk to you about, you know, just more detailed questions about, you know, what you're trying to do, and then from there we can talk about, you know, your surgery options
Okay.
and the dates that work for you for surgery, and getting you up here for surgery.
Oh
So
yeah.
I'm
Okay. I'm
more than,
definitely about. I'm definitely about to book that. I'm definitely about to.
more than happy to help you, but just I'm all about transparency too.
Right.
um, like my page is an open books, like, so you'll see in here my patients that I've operated on, including one that I'm talking to right now,
Look.
who's a patient
Look.
of mine.
Look. I was about to say. Look. I was about to say. I'm
Yeah,
aware. I've been watching. Look. I'm like.
I'm saying that to
hmm
say, I like the ability for women that don't know, that are scared, that are apprehensive, to be able to talk to other women that have been through the process, because I can only tell you how the surgery goes, the logistics, all of those things, or what have you. Actually, talking to somebody that's been through the process, that's had to travel,
Okay.
you know, fly, you know, stay in a hotel,
hmm
you know, come for surgery, have their family come, and all of those logistics are things that, you know, I definitely would like for you to just talk, you know, to people
Right.
that are here. Like I said, you know, I just gave you a woman that's been through it. Her whole journey and story is, if you scroll back, you can see her story too. But there's other ones that are in here. You can ask them, you know, some of the logistics. And then other than that, you know, I'm looking forward to talking to you soon and getting you
Okay.
scheduled, helping you.
Thank you so much. Thank
Real
y'all for adding me. I'm definitely going to schedule a consultation
no
as well.
problem. I'll talk to you soon. All
All right. Thank
right.
you.
Thank you for joining. All right, so I screenshotted the questions in the chat
What
already.
is people in here now, so I have to answer
Of course, as soon as we say we gonna come on and say we getting ready to go.
them. Now it's men in here, so this is one of my friends. Hold on.
Oh, okay.
Sir, how are you? You got a question? You want to join the live? This is what I do on the regular,
I
man. This is
see.
this,
I was just trying to join, just interact and see how you giving your information to the ladies, man. I was just listening.
that's what I do, man. You know, fellas have questions too, but this is what I do.
You do
So when I'll be like, yeah, I'm 8 o'clock talking to people about, you know, their life and surgery and all of this type of stuff, man. This is
you do a great job, man. I've been listening. But tell me out, because I'm not the woman to ask the question. I
all
don't have
right. You
time.
hop in here. I was making sure you had no question. I had to help you
Men
out.
ask questions
But yeah,
too.
No,
man,
I don't have a question. No, I don't have a question at this
Oh,
time.
thugs,
okay.
thugs need love too, bro. But I will talk later.
We'll talk later. All right, brother.
All right.
Bye bye.
Uh,
Yeah, guys definitely submit questions.
yeah. All right. This is the last one. Last one. This is two. Jesus. Hello.
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 Yeah.
How are you?
I'm good.
Got a question?
Can you hear me?
Yes.
Yeah, I can.
Okay.
We can.
So my name is Kiana. Thank you for accepting my my request to join. So I actually just had a pelvic exam, a pelvic ultrasound yesterday.
Mm-hmm.
I only have one fibroid. It used to be like 2.2 centimeters, but when I went yesterday, this was probably about 8 or 9 years ago, she said that it was 4.5. And I thought that it was pedunculated before, but then just found out she said it was in the muscle, so it's intramural. So
Mm-hmm.
um, don't know, what to do, but like I said, it's only one. I do have, I was told that I had endometriosis. Not sure, like if it was because I had childbirth early. I had a daughter at 15 and she's
Mm-hmm.
28 now. I'm 43. So,
Okay.
I just want my life back. Like, I mean, I like my cycles are normal. Like, well, it's real heavy.
I stay on like 3 days, and then I spot the fourth day. But that first day is really crucial
Okay.
for me, and just want some advice, like, and I've been seeing an African American doctor, Dr. Rashard, here in Nashville. I'm in Nashville, Tennessee. For my son is 24. He actually delivered my son in '01, and my son graduates from Fisk University Monday. Not to put
Okay.
that out there, but
Congratulations.
thank
Congratulations.
you,
Oh, that's awesome.
thank you. So, like I said, they did come with the well, you need to get a hysterectomy. And I'm like, I'm not doing it. I never got my tubes tied or anything after I had my children. I have 3 children, 3 adult children. And, I just want, like I said, I just got the one fibroid, and she said that it actually doubled in size. It's a 4.5 now. So, but I don't know. And that was just the ultrasound tech, but I don't know what I need to do about it. Like, cause he
So,
want to take it out, and I'm like, hell,
no,
is you going to give me the insurance money?
no. Your bleeding has gotten worse over what span of time?
Uh, Probably I say the last 2-3 years,
Okay. So,
but it's been
and
constant.
this
It's been like it ever since.
understood. Let me explain. So this is a common scenario that I see all the time. Two things can be true at the same time. One, you can have fibroids. Two, you can have physiologic issues that are causing you to have bleeding. Every woman, I don't care who she is, right? From the
Mm-hmm.
moment you started to have, from the moment you started to have your menstrual cycles to now, your ovaries started to do this. This is what your ovaries started to do. And at a certain juncture,
Okay.
they start, right? Your What probably happened is that your ovaries are starting to do this. When this happens, it can cause your body to start having very heavy cycles because your body, you're not ovulating regularly, and when you don't ovulate regularly, it can cause you to have heavy bleeding like you're having right now. So the it's very unlikely for this fibroid to be the source or the reason why you're having that issue. um, and removing that fibroid is not going to fix the physiologic change that is happening in your uterus.
Gotcha.
With that being said, I'm going to say a couple of things. Number one, ultrasound. So I want everybody to hear this. With ultrasounds, uh, you cannot take ultrasounds at face value, because
Mm-hmm.
if I send you to 10 people right now and get the same ultrasound, you're going to have 10 different readings. Some of them are going to say you have a 3.1. Some of them are going to say you got a 3.7. Some going to say you got a 2.5. Like, they're going to say all of a varying range of fibers. They're probably all going to say you have this dominant fibroid. They're all going to be different sizes with different texts, because the ultrasound is really based upon how they put that probe and position that probe, and then take the measurement at that particular angle of the probe. So
Mm-hmm.
if a different person, it's going to be a different reading. But I would argue that your fibroid is still within a reasonable or considerable range to say that it's not significantly grown from previous. And so, with that said, the location of your fibroid is extremely important. I would venture to say, even though I haven't seen your ultrasound, it's very unlikely that your fibroid is actually pushing into the cavity of your uterus, which means that it's probably not significantly impacting your bleeding. And so, with that said, you have other options. One option you have, there are medications that will help with the bleeding. That's an option. If you're not comfortable with medications, you don't want to do that. Then
Mm-hmm.
there's a procedure called an endometrial ablation,
I
and an
heard.
endometrial ablation is the burning of the lining of your uterus, which is an outpatient procedure. You
Mm-hmm.
keep your uterus. You won't be able to use it anymore, but it should significantly impact your bleeding without having to undergo a hysterectomy. That is a very, very viable option for you, if you want to significantly treat your bleeding without having to undergo a big surgery. But I don't necessarily think you necessarily have to have a hysterectomy, but it also depends on your appetite for what's going on with your body right now. So if you're like, hey, I'm tired of bleeding, I don't want to deal with nothing, I'm tired of pads, I don't want nothing, I want to be done. I want no more periods, I want to be done. And if that's the case, then yes, you should or could put hysterectomy on the table
Nah,
as an
doing
it, it would definitively do it, but you don't necessarily have to. And with that being said, for what I was saying about robotic surgery for myomectomy, none of that applies to hysterectomy. For hysterectomies, all of my surgeries are robotic or laparoscopic, meaning that I know there's a big misconception about hysterectomies, but the truth of the matter is, uh, a majority of my robotic hysterectomies, they're out of the hospital within 24 hours and they're back to work and back to normal activities within a week.
mm-hmm.
That includes working, moving, doing everything else, and they'll never have another period ever again. So it's a lot of myths surrounding hysterectomy. It's not for everyone, but it is for people sometimes, and they just being scared of the option and not really understanding the option. It's not always the greatest thing either, because a woman that has gotten cut hip to hip to have a hysterectomy, or cut from her privates to her chest, her, as in addition to somebody like Cola that had the exact same surgery but had it two different ways by two different surgeons and two different approaches, their experiences and their stories are going to be way different. But nobody's ever going to ask them, how did you get that done? In what manner, or like, what was the circumstances behind it? What was your pain recovery? Like, they don't ask those specific things. They just listen to hysterectomy and what experience is, and nothing else is asked after that. So I would caution you to say, hey, really get an honest assessment about what your options look like, and then make an informed decision from the truth and laying out everything to you. But I would not knee jerk say, hey, this fibroid is growing exponentially, you need to do something about it. No, that's not true. But if bleeding is to the point where it's significantly impacting your quality of life, then you can start to look at the options to address the bleeding. Does that help?
Right. And I don't really think that it's affecting the quality, because I'm still, like I said, I'm 43. I haven't really hit that, premenopausal stage or anything to that nature. They just kept saying that it was the estrogen or whatnot. They saying that it's the estrogen, but it has caused me to be anemic due to that one uterine fibroid.
It's not the fibroid. That's what I'm telling you. It's
Iron
not the fibroid.
infusions once a year, and I have
It,
been for the past
it's
18
not the
years.
fibroid. Not the fibroid.
It's not the
It's
fibroid.
unlikely. Now I can't tell you definitively that it's not the fibroid, but I can tell you without a reasonable doubt that it's probably not the fibroid. You just have abnormal bleeding or heavy bleeding from other physiologic sources. It's most likely not the fibroid. But there are other options,
So
like options.
got you. So if I came to see you to do a consultation, is that something that you could possibly detect or,
Absolutely.
get to the root cause of it?
Absolutely. So the first thing I would do is like take a very close look at your imaging. Like, I would see not just that one, but I would look at all of the ones that you have in the past, compare.
Mm-hmm.
Somewhere in there, somebody would have to have made mention that there's a submucosal component or intercavitary component of that fibroid. Then I would consider possibly that it could be contributing to it. But if that's in none of your reports, then what I'm saying to you is correct, that it's not your fibroid that's causing you to have bleeding. And then we could talk about all of the options in detail, as they make sense, to what fits the best thing for you. And, talk about, recovery, risk versus benefits, all of those things with all of your different options.
Oh, yeah, I need to get a consultation. My name is Kiana
All
Brown.
right, Kiana. I
So
look
is it
forward to
is
talking
it
to you.
information on how I am able to do that
Yeah, that's right.
on your site?
So I pinned that. So that
Oh, yeah,
website that's pinned,
fibroid clarity.
yeah,
Yep,
you go
I'm
right
gonna
to
do that now.
schedule your consultation.
And you're in where are you located again?
Chicago.
Chicago. Okay, I got family in Chicago, so it wouldn't be no problem.
Happy to help you.
Thank you so much, Doc.
You're welcome.
And I will be in
All right, I'll
touch.
talk to you soon.
Yes, sir.
Thank you.
Thanks. Thank you, ma'am. Thank you so much.
All right, I think we are all set. And yes, hysterectomy is not a death sentence. When it makes sense, it could be a very, 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 very great choice. I will be the poster child of that.
Put one more very on it so they get.
Man, I can't say very enough, but it could be a very, very good choice if it
Where
makes sense.
where your husband? Let him chime on.
Yeah, I be telling him that people have questions for him. He's such a jerk though sometimes. I gotta be worried about what he might say. Cause
No, let
he,
him say what he gonna say.
he a little bit I be trying to put that short leash on him, you know, he just wanna gnaw it off. No.
Gosh.
But I did tell him that people tend to have questions, so I am trying to get him to participate at least one point. Told him I won't ask him nothing too crazy.
All right. So this last question people wanted to ask about just insurance. All right, real quickly, your insurance, right? The way insurance works for me, I'm at a safety net hospital. I'm at a hospital I that doesn't turn anybody down. I'm here for a reason. For that reason, I never want anybody to come to me and say I can't operate on them and I can't take care of them. That's why I'm here. With that being said, if you have insurance, if you are in Illinois, you have Illinois insurance, whatever it is you have, we'll take it. Whether it's the worst of the worst Medicaid, whether it's the best of the best PPO, I will take your insurance. You can come in to see me. You never have to like do no virtual consultation. You come right here and use your insurance to see me, right? If you are out of state, um, uh, Florida, California, Georgia, wherever you're from, right? It works like this. If you have Obamacare or any type of like MCO or any state-run insurance, that insurance will keep you in the state. You can't escape that. They're not going to pay for you to come to Chicago to have surgery or consultations. You can always get a virtual consultation. You have to pay that out of pocket. If you have commercial insurances, HMO plans typically will keep you in a network, right? Meaning that the insurance companies have the hospitals, the doctors, they pretty much pigeonhole them into charging the price that they want. And so for that, they have a lower rate for those patients. So they go to the doctors, they say, the hospitals, they say, and it really keeps you in one area. It's good insurance, but it doesn't allow you to travel. For people that want to travel or whatever, you need to have a PPO insurance if you're out of state. A PPO insurance allows you to travel, allows you to choose whatever doctor that you want to choose for your care. To that end, if you're like, well, I just have my insurance, I just can't do it or what have you, such and such. The fix to that is very easy, right? It's not very easy, but it's a fix to that. So you utilize insurances to your advantage, right? So if you have an HMO or if you have a Medicare plan, Medicaid plan, right, that and you're outside of Illinois and you want to come or go anywhere for surgery or for your care, you wait to open enrollment. You if you get a PPO plan that allows you to travel, and then you get your surgery, right? It may take a little time, but you got to think about it. Like, this is your life and your health, right? If you have advanced fibroid disease, don't just say, hey, I'm just stuck in this area. I got to do it. Let them do whatever they do to me because I can't figure this out. Just wait, get a PPO plan and be able to travel and get out of that situation. Yes, it is more expensive, but mind you, it just, a PPO plan is probably going to cost you another $300-400 a month, which at the end of the day, I'm not counting anybody's money, but it's like, another $3,000-4,000 a year to get a $30,000-40,000 surgery plus. It's not even that. It's like without that, it's $90,000-100,000.
Yeah, I
But
was gonna say it's more like six
right
figures.
out of pocket, right? With the charity care, like that you could have if you had no insurance and came to me and say, hey, I don't have insurance, I want surgery. Out of pocket, you're looking at 20,000-25,000. But if you don't want to pay that, then you wait to open enrollment, you get a PPO plan, and you get the surgery that you need for another $3,000-4,000 you pay for the year. And then when open enrollment comes around again, guess what? Go back down to the plan that you were at. Like, it's I'm giving
Use
you
them like they use you.
I'm giving y'all free game. Like, it's just think. It's just common sense. Like, you can do anything that you want. You just have to think about it. Yeah.
I agree.
Not doing anything is expensive as well too. You just sit there and you let the fibroid get bigger, you get bigger, get bigger, And guess what? And the bigger your fibroid get and the worse it gets, the less the options you have for surgeons, because the comfort level goes down, the experience level goes down. So you have to make decisions that are going to be beneficial to you quickly.
Yes.
You know, but I by no means do I say, hey, you don't have any surgeons in your area. Everybody telling you need a hysterectomy, or nobody else is telling you that you could have a minimally invasive scar. You got to have a vertical incision. Don't do that to yourself.
Mm-hmm.
Like, think about that. Just you can think and utilize the resources that you have. All right,
I agree with that. Even your Danielle talked clearly about how you was in doctor number 10. So if you and she finally found somebody. And even for me, and I don't know if it's because I'm in Chicago or not, you were doctor number 3. So, I just got to you faster, but yeah, you will find out that it is not the same skill set. I mean, I was in your own office, and the receptionist was like, good, you ain't make an appointment with the other doctor, because she wouldn't have offered you blah 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 blah. Like, the receptionist told me I make a decision. So it's bad when you come to the office and they say that.
But the crazy part, like, it's women that know me outside of the world. Like, I mean, outside, not the world, out of the country, like, that know who I am, where I'm at, all about me, like, that are everywhere else. But it's so many women that are in Chicago that don't even know I exist, that have no idea. Like, I literally had a woman today. She was like, my friend from Atlanta told me to come in and see you. I was like, you live here? I was like, they have no idea. I can't heighten the awareness in my own city. Everybody knows me outside, but it's crazy that I can't, like, get people to even know I'm here in Chicago. I don't know why that is, but it is what it is.
Because in Chicago, people are caught up on the name of the hospital.
Oh yeah.
So they not. That's the problem in Chicago.
Yeah, that's true.
I learned that a long time ago. Don't even worry about that. Like, I picked my OBGYN just because she did her residency at Cook County. Because I said, if it ever happens, you saw it in your residency, I want you. I didn't care where you work at now. I want the person who had the most experience or saw the worst.
From the Virgin Islands. I love it.
I love it. Yeah, so no, that's what's wrong sometimes. Chicago is very caught up on names.
Yeah, and I was just looking at somebody tuning in from the Virgin Islands. That's dope.
No, that's real dope. So yeah, I can see why people wouldn't know, because they not checking for that first.
Put a Chicago onto you yesterday. That's great. Like, cause I've been talking to her on DM, whatever, just trying to advise her, like, kind of navigate. Maria, I've been navigating her, like, through her fibroid journey, trying to get her somebody where she lives in the UK to help her. But she was like, she had to talk to somebody in Chicago, like, hey, you know about him? I'm like, that's crazy. That's crazy to me. But
It is. Well, I definitely be putting that name out there for sure.
Yeah. All
right. Well, I won't say how long before the next one, because whenever I say 2 weeks, then I get busy.
No, we're gonna get more consistent.
Yeah.
And my assistant right now, she is working on an actual, like, a true fibroid slayer community where, like, all my patients, everybody following me or whatever, will be able to go to a place to, like, have a whole forum where I go in there. So we're gonna transfer that over there, and literally have, like, a whole community where, like, women answer questions and they put up stuff, whatever. Even when I'm not around, y'all guys can really talk and invite women that need to hear stories and stuff or whatever. So I'm right now. I should have that within a month, actually. Like, we've been talking about that actively. So I'm going to work that out. It's 2 different platforms that have it. They're not social media platforms, but they're 2 different platforms, that I'm looking into figuring out which one I want to go with. But I'm going to have that really soon.
Awesome. Yeah, I feel like you mentioned that a little bit, but like I said, whenever I say I'm gonna be cool, then it all of a sudden picks up. And when I do the thumb, what you got an iPhone? What?
But I don't know why.
Is it a 15 and up?
Hell no. It don't do it when you want to do
Oh,
it.
it's
You just do it.
when you're not trying to do. Okay, because I know my kids got a newer one. I was wondering, is it the new stuff? All right. Well, thank you
All right.
again. We definitely
Hold on.
appreciate you. Like I said, if you
I,
submitted a
I
question,
you in. It's not. Who is that? Stacy. I tried to get you in. It's just like spinning. I saw you in there, and I tried to get you in here. So I had to get you in last time, but like sometimes IG, that was the last
and
one. Literally.
we over that time. Sometimes it
Yeah.
start hating once you get to a certain time limit.
So you will be first next time we on here. We'll do that. Let's do this every 2 weeks. Let's just make it so it's like a 2 week thing.
Okay.
But we'll do this every 2 weeks because I like it. I think it benefits people.
It definitely does. I've talked to several women this week, and it's definitely benefiting. Definitely, several women this week.
Yeah, Stacey, I think it's just because we're close to the 2 hour mark, and so like
It's tripping.
it's not letting us be great. So I'm trying, but nonetheless, just reach out to me. I'll try to answer the question, and if not, if you want to hop on here next time, you'll be the first one to get on. So my apologies for that. But all right.
All right, then. Well, you have a good rest of your evening and get home safe.
Home. All right, y'all.
All right.
All right.